Think of a friend, someone who could get pregnant. Maybe they are a parent of 3 kids, or a teenager juggling school and basketball, or someone who needs birth control to manage a medical condition. Now imagine them deciding to start birth control and trying to get care at a clinic. A lot has to fall into place for that to happen. And even more has to go well for them to get high quality care that actually meets their needs. They have to find a clinic with an appointment that works for their schedule. They might need to sort out childcare, time off work, transportation, or squeeze in a visit between everything else going on. Once they get there, they need a care team who listens to them, respects their values and preferences, and explains things clearly in a way and a language they understand. And of course, they need insurance or enough money to cover the cost. If even one of these things doesn't line up, they hit a roadblock. And if they can't get the care they need, their reproductive autonomy is at risk. So what is reproductive autonomy? It's having the power to make decisions about birth control, pregnancy, and having kids or not, on your own terms. Having equitable and patient-centered access to birth control for people who want to use it is key to making that happen. But this isn't just about a one-time experience or decision. For a lot of people, birth control is something they may need for decades, and for a wide range of reasons. Access to birth control is a powerful thing. It's not just about preventing pregnancy, it's about health, well-being, and having options. It can lower the risk of pregnancy-related mortality. It can help space out pregnancies, which is good for both parents and kids. It can support education and career goals. Some types of birth control offer even more benefits, like easing painful periods, clearing up acne, and reducing the risk of certain cancers. No wonder the Centers for Disease Control and Prevention called family planning one of the 10 greatest public health achievements of the 20th century. And yet, too many people still struggle to get the care they need. Nearly 1 in 5 women of reproductive age in the U.S. say it's difficult to access birth control in their state, especially younger people, those without insurance, and those with lower incomes. And it's not just about getting birth control, it's about getting the type of birth control they want. Even though almost every sexually active woman between 15 and 44 has used birth control at some point, nearly 1 in 4 isn't using their preferred method right now. Only 30% say they got enough information to make an informed choice. These barriers are real, but they're not impossible to overcome. When we recognize the problem and commit to better care, we can change things together. At the end of the day, reproductive autonomy is about having control over your own body and future. And that's something everyone deserves.